This presentation is going to be about pharmacies. During this video, I'm going to compare and contrast problems and solutions in three major areas of pharmacy. These areas include hospital, retail, and independent pharmacies. This topic is important for future pharmacists as many of the issues will manifest in real-life situations while out practicing in the pharmacy world. The solutions presented in this paper can serve as a basis to tackle major issues the pharmacy world currently faces with the hopes of solving them for a better future. Student pharmacists will benefit from familiarizing themselves with current challenges and will be prepared to be a part of the solution as they continue their journey into the pharmacy profession. The first area of focus is hospital pharmacies. A major barrier to patient care in the hospital is the high cost of treatment. Hospital services can quickly become pricey even when a patient stays for a short amount of time and for a very minor issue. Because of the high cost, patients will often neglect to take their medication, which leads to patient adherence problems. Patient adherence is a major issue because patients are either not taking the medication they need or they are taking the medications incorrectly. Deciding to not take medications or taking medications in an unsafe manner can result in further health problems, with current health problems going untreated. For hospitals with a high volume of patients, time is also a constraint. Not all patients can be educated, and if they are, the session may be insufficient. Patients who are discharged from the hospital and return within 30 days of being discharged cost the hospital money. Therefore, one of the goals of a hospital pharmacy is to take enough time to educate patients and change lives one at a time. Pharmacists educate patients on how to take their medications in hopes they will not be readmitted anytime soon for failing health, and in hopes that they will take control of improving their quality of life. The second area of focus is retail pharmacies. A large portion of pharmacists in America practice in retail pharmacies and provide healthcare advice through patient counseling and dispensing prescription and non-prescription medications to the public. Some pharmacists may spend about 25 years or more at the same pharmacy, but it is also common to move from store to store based on need. This can result in a lack of uniformity within the pharmacy. Medication errors are also another problem faced by retail pharmacies. Some factors that contribute to medication errors include communication, problems with package labels, work overload, the physical structure of the working environment, distraction and interruption, the use of incorrect and outdated information sources, and the lack of patient knowledge and education about the drugs they are using. An important solution to prevent medication errors is patient counseling, which involves communication and knowledge from the pharmacist that is delivered to the patient. It is important to counsel the patients in an open and friendly manner. There is not a definite list of information to tell patients, but a few pieces of required information that should be relayed to the patient include the medication name, strength, form, use, expected action, directions for use, any special instructions such as storage, side effects, potential drug interactions, warnings, and when and how to stop taking the medication, and also where to seek help. The third area of focus is independent pharmacies. The history of pharmacy is most often based on the presence of small independent pharmacies, with the evolution of chain and mass merchandiser pharmacies in the early 1900s. It is also common to find small, well-known staff present within an independent community pharmacy. For independent community pharmacies, one of the biggest issues is insurance. It is difficult to achieve a well-functional relationship with third-party payers, but it is essential for independent businesses in order to keep their business alive. Offering unique services like medication therapy management and various technological advances keeps independent pharmacies thriving. Another problem faced by independent pharmacies is the availability of online drug information databases. Textbooks can also be used as references, but books cannot be updated easily, and buying the new edition can be pricey. Also, paying for access to online resources is also very pricey. Therefore, some independent pharmacies choose not to pay for online resources, especially if they are only referenced a couple of times. In conclusion, healthcare is a team effort. Some members help diagnose the disease and others treat or care for the disease and the patient's emotional and physical needs. Pharmacists can be a part of this team through dispensing medications that the doctor has prescribed, educating patients on how to use them, and recommending dosing. Teamwork is also an important part in order to provide patient-centered care. The future world of pharmacies looks bright. Pharmacists continue to become more involved within the healthcare community through more patient interactions. It is even likely that pharmacists will receive provider status in the near future. This means that pharmacists would be able to bill for their services within the scope of their practice as defined by the state. Subsequent studies could include the impacts of provider status on the pharmacy world, or more detailed studies on how medication errors can be resolved. And there's our resources.